Well, my name is Phillip Pellitteri, and I'm chief of the section of otolaryngology head and neck surgery here at the Guthrie Clinic. And I'm virtually the service line leader for otolaryngology head and neck surgery throughout the healthcare system in all of the regions that are served by the Guthrie health system. I think what stands out above anything else that I had seen, and I looked at a number of different opportunities both within the state of Pennsylvania and outside of it within the Atlantic region, is that the clinical leadership is truly invested in not only the physician contingent throughout the healthcare system, but all the employees. There's a sense of engagement by clinical leadership that I had not seen duplicated in systems of similar size and scale. And I think that that probably impressed me more than anything else, that truly the patient-centered approach with an orientation toward growth, expansion, and service to both patients and employees was very important and was directly in the target line of clinical leadership. And so I found that very impressive and was attracted to it immediately. If you can contrast this to other healthcare systems, again, of similar size and scale, I think the distinction here is that patient-centeredness and patient care focus is something that is actually lived as opposed to just spoken about and advertised. And I say that because in reality, clinical leadership has engaged individual leaders both from the business standpoint as well as the clinical standpoint to make that their priority. I think the second reason is that we don't have an overwhelming medical bureaucracy at Guthrie, whereas other healthcare systems tend to create processes that oftentimes will get in the way of efficient patient care and compassionate patient care. Even though their intentions are very good, those processes seem to get in the way. I think by engaging leadership at all levels, Guthrie has taken advantage of all the manpower they employ and been able to focus all the efforts on the patient. What's been refreshing to me and for me is being able to work around people who I think genuinely enjoy where they work and enjoy the fact that they're able to help people and at the same time be able to promote their own growth, both personally and professionally. So that's been refreshing. I can't say it's been an actual surprise because I kind of got a feel for that as I was interviewing here and looking at this place. But I think I've seen basically from clinical leadership all through all support services that's the basic tenet of how people feel.